This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. Our guest this morning is Jennifer Bender, Perinatal Nurse Navigator, as we'll be talking about postpartum support at Mon Health. Jennifer, good morning. Thanks for joining us.
Good morning.
Well, it is our pleasure. Jennifer, we're going to get into postpartum support at Mon Health this morning, but as we do with all of our guests, I have to put you on the spot at least for a minute or two to talk about yourself. So, Jennifer, here's your time to talk about yourself. Tell me about your background, education, and how you ended up with Mon Health.
Great, thanks. So I'm a nurse and a board-certified lactation consultant, and I've been a nurse for 22 years and a lactation consultant for 21. And I'm originally from Southern Maryland. My family and I moved here in 2006. We absolutely love West Virginia, and it's definitely our home now. I specialized in women's health and families because I just love it. My husband and I have a blended family, and so combined we have 7 children, and I just love helping families get to their goals. So,
two-part question then. One, what drew you to nursing in the medical field anyway, and getting to work with the families? What's the most satisfying part of the job?
Yeah, I mean, nursing I was a single parent when I went back to nursing school, and it was a great career, has been a great career for me. And, I guess the best part is seeing parents kind of evolve as parents, as new parents. As you add a new baby, your life changes. So it doesn't matter how many kids you have, it's different every time, which is really cool. And just to see people grow in that role of parenting.
We often talk about on this program, it seems like this comes up on a fairly regular basis, Jennifer, that at Mon Health, if you come in for a procedure or you come in for whatever reason, you visit a doctor, visit a physician, you're not just left to go, once that procedure's over, send you home, good luck, have at it. There are services to help. And the same, obviously, because we're talking about postpartum support at Mon Health, the same can obviously be said about having a child. You don't just send the mother and father home and go, all right, good luck with that. So what kind of services are available at Mon Health?
That's very true, and I think it's awesome that Mon has taken on this P3 program, which is progressing through postpartum. It actually starts in early pregnancy, and we enroll you in the P3 program. P3 has expanded. It used to just be me. Now I have 2 other colleagues that do support as well. We have a perinatal social worker and a perinatal coordinator who just walks you through the whole process. So we follow a proactive outreach model. So basically we want to prevent a problem before it's a problem. Pregnancy is normal and healthy, but it doesn't always go that way. So we want to make sure you have the support you need. You have a trusted person to reach out to. We work virtually, so it's very convenient for our patients, and we want to support you in every aspect of your journey of parenthood.
Who has access? Is this for new first-time parents? Can it be, 3rd, 4th, 5th-time parents?
Yeah.
Who has access?
So at Mon Health Medical Center in Morgantown, every patient that delivers with us gets proactive outreach post-delivery. And like I said recently, we're starting to enroll people during the pregnancy. And then at Stonewall Jackson, our sister hospital, they also have a P3 Navigator. So both places, if you deliver with us, you will get this follow-up service, basically. And anyone that wants to join into the program can contact us, and we will follow up with you once we get some basic information from you.
Talking to Jennifer Bender this morning, Perinatal Nurse Navigator, talking about the postpartum support available at Mon Health. Can you, in a nutshell, I mean, there's a lot of things we can go down, but give me kind of the basic overview of a new mother, a new family, or mother or family. It doesn't have to be new, obviously. You meet them for the first time. Can you just kind of walk us through the process of the P3 program?
Sure. Yeah, so most of our outreach is virtual, which our patients really love. It's very convenient. So basically, you deliver baby at Mon Health and you receive a message from me introducing myself and letting you know that I'm a nurse, I'm a lactation consultant. I can answer questions, concerns about feeding new baby, recovery. We also support partners if they want to. So that's part of our new enrollment process in pregnancy. If the partner wants support, we're there to support the whole family unit, however that looks. And so I continue to outreach several times in the first month post-delivery. And actually, throughout the whole first year now, we've expanded some of our services and capability, and that's been fantastic. So basically, you're just going to keep hearing from me. Text message is super convenient, and patients really love it because when you have a baby, 2 a.m. might be the only time you actually get to pick up and look at your phone because you're up in the middle of the night with a baby, and you can respond. And then I'll respond back when I get it in the morning. So it's super convenient for our patients.
You mentioned partner support or partner services. So for the sake of conversation, you're there to help dad out as well, too?
Absolutely, because perinatal mental health affects everyone in the family. We know that if mom has struggled with mood changes related to pregnancy and postpartum, dad is more likely to also experience those changes. And we know that partners are just as important to this family unit. So we are available to reach out to partners as well and support them in their parenting journey.
So what kind of, and you can get into some of the specific services that are available. So what kind of services are available through P3?
Right. So we do proactive outreach. We also do follow-up lactation consultations at our office to help with any feeding concerns. We also do therapy referrals for any of our patients that want to seek therapy to help with symptoms that they're having. Therapy is an awesome thing to do lifelong. It's statistically the best way to approach any struggles you have. And we have people that have specialized training in maternal mental health, so they really love our patients. We also have virtual support groups. We now have 6 virtual support groups. So, we reach out to you in any way we can, and we're going to be there through the whole first year.
Those virtual support groups, it has to be, I don't know if comforting is the right word, Jennifer, but just to know when you're going through something, baby won't sleep through the night, or baby, maybe's not eating as well as he or she should. Just to know other people are kind of dealing with the same thing, that has to be, again, I don't know if comforting is the right word, but it has to help, doesn't it?
I really do think it's very comforting, and a lot of this journey of parenting is just knowing you're not in it alone. One of the things you really feel like when you have a new baby, again, no matter how many you have, is it's kind of isolating at first. Flu season is hard on people. Can I leave the house? Should I leave the house? Can I have people come support me with meals or watching the baby? So just that affirmation and being able to run something by somebody else that you trust, that you've kind of established a rapport with. So that's our goal, is to give support and to make sure that all parents know they're not alone in this journey.
Jennifer Bender is joining us this morning, perinatal nurse navigator. We're talking about postpartum support at Mon Health. We'll continue our conversation right after we squeeze in a quick break. This is Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Jennifer Bender is our guest this morning, perinatal nurse navigator. We're talking about postpartum support at Mon Health. I think I neglected to mention April is Women's Month, focusing in on postpartum support here this morning. And Jennifer, can you talk a little bit about the importance of having that support, having postpartum support services?
Yes, it is extremely important. It's great to make a postpartum plan. We spend a lot of time talking about pregnancy and birth, and those are very important things. Then you have to take the baby home and try and get some sleep and try and take care of yourself. So making a postpartum plan is really important, and putting things in place that you have the support you need. So that really helps with mood symptoms. 70% of women have mood changes related to pregnancy and postpartum. So it's important to address. It seems very basic, but sleeping and eating are a really hard thing after you have a baby. And so if you don't make a plan of how you're going to get sleep, and lots of moms lose their appetite, we have to take care of the mom. So making a plan is very, very important.
Have you heard this? Just throwing it out there, Jennifer. Well, Grandma didn't need to have one of these plans. These weren't available to Grandma or maybe even Mom, 25, 30 years ago. So why do I need to go through this? What's the big deal?
Yeah, I think our society has really shifted from having that it takes a village support. Back when my mom had kids, most women were home full time. They weren't going back to work in 6 to 8 to 12 weeks. So I think there's a lot more pressure on moms today to be everything for everyone instead of focusing on recovery and learning their new baby. So I think things have changed in that we don't have as much nucleus family support as there used to be. So making a plan with the people around you is very important.
That is a great point, Jennifer, and I hadn't thought about it until you just mentioned it. You grow up, a lot of us move away from home, so mom, grandma and grandpa are, maybe 4 or 5 hours away, maybe on the other side of the country, whereas, traditionally or a couple of a generation ago, you probably had not only grandma and grandpa around, but aunts, uncles, cousins, and a lot of people there to help and support. So I can see where you would get that lonely feeling that that you're on your own. If in a lot of ways you are, I guess.
Yeah. And also we're very independent. I think Americans in general are very independent people, and we want to do it ourselves. Mountaineers especially, we want to take care of ourselves, and that is a great quality, except you need support, and it almost feels like you've failed if you need help. God forbid you need help. And that's just not true in having a new baby, welcome them into your family. We all need support. So, and it blesses other people to let them support you. So just kind of changing the shift of I can do it myself. I can do it all. I'm going to do everything for my baby. Shift to we all need support.
That's right. We don't need any help. We're West Virginians. We can do it ourselves. I know that attitude very well. The P3 program, Jennifer, this is actually a first of its kind in West Virginia, isn't it?
It is indeed, yes. I'm very proud to say I've worked for Mon Health for almost 17 years. It's a wonderful organization, and I feel like our administration really supports best practice, and that's what we do at Mon Health. That's one of the reasons I'm very proud to work for Mon Health is we work out best practice, and that can be hard, and it's a commitment. So it means a lot to be the first in West Virginia that's specifically focused on supporting our moms after they have the baby and the dad after they have the baby. So it's a privilege to work here, and I think Mon Health continues to demonstrate that we do meet each person one at a time at their unique needs.
Jennifer Bender is our guest this morning, perinatal nurse navigator. We're talking about postpartum support at Mon Health. Got to take our final break. We're back to continue the conversation in a moment. This is Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Jennifer Bender is our guest this morning, perinatal nurse navigator. We're talking about postpartum support at Mon Health. And Jennifer, what's some of the feedback you get from the mothers and the families you work with? What do they say about the program?
Yeah, that's a great question. So we do survey our participants and to know how we're doing and what we can do better. And the feedback has been very positive. Many have said, I can imagine having a baby without this service, this follow-up, and so many positive comments. It's just, I don't even know the word, it's very gratifying to know that we are meeting people where they are. That's the whole intent of the program. I often say, I can give you all the numbers and here's who you call when you have a problem, but when you're exhausted and you're recovering, it's very difficult to pick up that phone and make a phone call and know who to call and what to tell them. So the proactive outreach model meets them where they are and gives them that easy resource for follow-up.
That seems like a real difference maker because of all the reasons you mentioned, Jennifer, you might be hesitant. You don't know who to call to reach out to for help or to ask questions. You might be a little, we've established West Virginians, we're a little stubborn. We like to do things on our own. There is that. So, and for some people, maybe they don't want to be a bother. They don't want to reach out.
Right.
So having that open line of communication there, initiated by you and your coworkers, your colleagues there, I think that seems like a game changer when you're talking about this type of support service, and after the baby, before and after the baby arrives.
Yeah, I really do feel like it's a game changer for people, and I've gotten much smarter, learned the 4 years I've been doing this, 4.5 years, to ask better questions. If I say, hey, how are you doing? You kind of get a program response. I'm good. Yeah. I'm fine. We're great. But I've learned to ask better questions like, how is your mood? And at first, it was kind of shocking to see what people actually were responding when I asked a better question. So I often get things like, do you think this is worse than it was in years past? I don't think it's worse. I think that families have often suffered. I think we have less support now physically, maybe nearby, like we talked about, but also it wasn't asked. Everybody knew somebody that had a significant mood disorder after they had their baby. And I'll hear statements like, yeah, my aunt, she just was never the same after she had her baby. That's not okay. We shouldn't accept that as normal because it's not normal. So I think it's always been there. We're just asking better questions now so that people feel comfortable saying how they're doing. And the other great thing is because we're a connection within their office setting with their providers, I can get you in the office quickly. We can address things and get you on the path of recovery. The great thing about postpartum mood changes is they're very treatable and they do get better. So it is definitely worth treating.
It seems like a lot of that, I'm just sitting here thinking, Jennifer, and take it for what it's worth. When I start thinking, we usually get into dangerous territory, but a lot of that you get, baby's up, getting fed every 2 hours. You're not getting as much sleep. You're just a little cranky. It's post-pregnancy hormones. It'll wear off. It'll go away. And for what you're talking about, it just kind of got sloughed off to the side. That's the medical term, right? Sloughed off to the side.
Yeah,
but it didn't get talked about like you're giving us examples today.
Yeah. So, some mood changes are normal, and having a new baby is a lot. That can be pretty overwhelming for the first 2 weeks. I always say, it's like PMS on steroids. I mean, the random crying, the feeling panicked, feeling overwhelmed. That's very normal the first 2 weeks. But if you cannot sleep and you cannot eat, that's completely different. So, yes, it is normal to have mood changes, but there's a limit to that. So if it goes beyond 2 weeks, or a lot of people don't realize that when you're overtired, you can't sleep. So this is not the baby's been up all night, I can't sleep. The baby is sleeping great, and I cannot fall asleep. So that becomes a problem, and insomnia is a very big problem. I mean, lack of sleep is truly a form of torture.